Hello, hello, hello. Welcome back to my channel. It is me, it is I, it is she, it is her, it is thee, it is who. It is Rosie Rosette 2020. Who? You can't hear me? It is Rosie Rosette 2020. Bye. Um yeah, I just wanted, this is going to be like a 2-3 minute video regarding, today is breast cancer month and I do need to go get my mammogram, right? My mammogram because it's breast cancer awareness month. Now I think I've gotten 2, and it's not that bad, well, I mean, if you have boobies, then it's they just smash it. But as much as my nipples, and I hate to be TMI, but sometimes as much as my nipples itch or whatever, that's a blessing. I got huge nipples or whatever. This is not that type what this video is all about. But you know um I just don't understand. There's just not a lot of things going on. Like, I don't hear anything about, National Breast Cancer Month. I don't hear anything. Do you guys, or is it just me? Because I'm not hearing anything. Like, no pink or no red or anything like that. But, there's a lot of people not in my family. I don't think there's anyone in my family that has died of breast cancer. I think my best friend, I think her mom just passed away of breast cancer. Now I know my other ex-best friend, her aunt passed away of breast cancer. And I think this other girl, her mother passed away of breast cancer. But I honestly, I don't have too many people in my family that I know. Uh-uh. I don't think so. I don't think I have a lot. But, ladies, we definitely have to make sure that we get the mammograms because, I mean, it is relevant. There's a lot of people who are dying. There's a lot of women that die. And then early prevention is good. It is honestly good. Let me see. I'm just going to look up the stats. Because I don't, like, there's nothing on YouTube or, okay. No. Okay, sorry. Come on, I just want, the numbers. Can I get a graph? There's like nothing, that's weird. Okay, what is the death rate? All right. So when I think I was researching something, I think I was researching the cancer rates in San Jose because there used to be a lot of silicone, and from what I heard, there's a lot of bad water where I live, right? And I was trying to look that up. Let me see. Okay, let's see if that can work. No, there's a reflection. Well, anyway, I was trying to look where, I couldn't find anything on cancer rates. I cannot find anything. But anyway, okay, the chance that a woman will die from breast cancer is about 1 in 39, about 2.6% since 2007. But we're in 2021. Breast cancer death rates have been steady in women younger than 50, but have continued to decrease in older women. Really? Well, I wonder why is that? Why would it decrease in older women? From 2013 to 2018, the death rate went down by 1%. Well, that's anything that's going down, I can live better than anybody else. The NCI reports, I don't know who NCI is, that 90% of women with breast cancer survive 5 years after diagnosis. This survival rate includes all women with breast cancer, regardless of the stage. The 5-year survival rate for women diagnosed with localized breast cancer is about 99%. So I guess they're saying if you get it, you have 5 years. Unless it's at a, a stage 4 or something like that. I'm not exactly sure. Okay, what is the highest cancer death rate? What were the leading causes of cancer death in 2019? Lung cancer was the leading cause of cancer of death accounting for 23% of all cancer deaths. Other common causes of cancer death were cancers of the colon and the rectum, the pancreas. Okay, so the colon and rectum was 8%. The pancreas was, the colon and the rectum was 9%. The pancreas was 8%. Female breast was 7% because men also get breast cancer. Prostate was 5%. Liver and intrahepatic bile duct was 5%. Now that was in 2015. So let's get that again. So the rectum, the colon and the rectum is the highest. No. The highest is lung cancer. Then it's the colon and the rectum, which is 9%. Then it's the pancreas, which is 8%. Then it's the female breast, which was 7%. They don't specify male breast cancer. Prostate is 5%, and liver and intrahepatic bile duct is 5%. That's interesting. Since the hazard rate associated with inflammatory breast cancer shows a sharp peak within the first 2 years and a rapid reduction in risk in subsequent years, it is highly likely that the great majority of patients alive 20 years after 20 years after diagnosis are cured. So I'm confused. So that means that I don't know, because I just read that. Okay, so once you find out that you have breast cancer, basically you have 5 years. But did I just read if you live for 20 years with it that you'll be okay? I don't know. Do you need chemo for stage 1 breast cancer? Chemotherapy is usually not part of the treatment regime for earlier stages of cancer. Stage 1 is highly treatable. However, it does require treatment, typically surgery and often radiation, and a combination of the two. Okay? What is the hardest cancer to treat? Pancreatic cancer develops quickly and with few symptoms, making it one of the most deadly forms of cancer. In addition, pancreatic cancer has shown resistance to chemotherapy, so new clinical trials are taking place to develop alternative treatment. I think my aunt passed away from pancreatic cancer. Like literally, she was diagnosed, and when she was diagnosed, it was stage 4, and I think in less than a year she was dead. Yep, less than a year she was dead. Can you fully recover from breast cancer? Most people fully recover with treatment. Talk with your doctor if you develop any symptoms after radiation therapy or okay, you know what? What are the symptoms? What are the symptoms? I need to know the symptoms of breast cancer. That's, how do you know you have it? Let's investigate breast cancer symptoms, okay? Here we go. Okay, here we go. Okay, breast cancer. Okay, come on. Okay. All right. So what what does early stage breast cancer feel like? Early warning signs of invasive breast cancer. Increase in breast size or shape over a short period of time. Touches, changes in touch may feel hard, tender, or warm. Warm. Hmm. Peeling or flaking at the nipple skin, a breast lump or thickening. See, I didn't know to feel warm. That's a that could be a part of the one of the symptoms. Okay. The most common symptom is a lump in your breast or armpit. And that's why I'm always feeling to see I think in your lymph nodes if there's a lump, especially, when you're putting on deodorant, check. I'm not going to feel my breast on camera. I'm not, but I will check my underarm. And right now I don't feel anything, but I heard it's like a rough rock or something. Okay, the most common symptom is a lump in your breast or armpit. Others include skin changes, pain, a nipple that pulls inward. I didn't know that. So if your nipple pulls inward, I didn't know that. Okay. And unusual discharge from your nipple. I didn't know that either. Okay, what are 7 signs? Okay, here we go. What are 7 signs of breast cancer? Okay. Swollen lymph nodes under the arm or around the collarbone. So this is the collarbone. Women and men, but you have to be aware of your body. Like I was telling you, I don't know if I was telling you, but this doctor, when I had an injury at work or whatever, and he was like, "Oh, I'm going to send you for blood tests. You might have some type of disease or rheumatoid arthritis or whatever." I said, "Look, I'll go take the blood test." I said, "But I know my body. Okay? This is an injury. This is not a disease." Took the blood test, nothing came back. I know my body. I know when something's wrong. I know when I'm about to, get the flu or get sick. I know when that time of the month is going to come. I can feel, well, actually, I can feel my breasts when that time of the month is coming because they're already big, but they get like really swollen. Let's say, I'll just say that, right? And then my nipples start to, okay. Okay, so I didn't know that under the arm or around the collarbone. So it may get swollen. Swollen of all or part of the breast. Now see, like I said, every month my breast gets swollen around that time. So that, is that a symptom or is that something that's just consistently happening? Skin irritation or dimpling. I didn't know that. Okay. Breast or nipple pain. Well, what type? Okay. Nipple retraction, redness, scaliness, and thickening of the nipple or breast skin. Nipple discharge. Okay, let's go over that again. Swollen lymph nodes under the arm or around the collarbone. Swelling of all or part of the breast. Skin irritation or dimpling. Breast or nipple pain. Nipple reaction, redness, scaliness, or thickening of the nipple or breast skin. Nipple just discharge. Listen, I'm learning things. How quickly does breast cancer grow? That's a good question. Overall, the average doubling time of breast cancer was 212 days, but ranged from 44 days to 1,800 days. 210 days, that's less than a year. That's less than a year. That's how fast breast cancer can grow. Doubling time is the amount of time it takes for a tumor to double in size, but it's hard to actually estimate since factors like type of cancer and tumor size come into play. Okay, this is a good one. Can you have stage 4 breast cancer and not know it? They can detect early signs of cancerous changes. Although not all stage 4 cancer will include large tumors, many women will be able to see or feel a lump in their breast. It may exist under the armpit or somewhere else nearby. Women may also feel a general swelling around the breast or armpit. That's kind of scaring me because, every month my boobs feel kind of heavy right now, depending on, well, it's the bra. It's the bra because, without the bra, my boobs don't even really feel that good, but they were kind of perky the other day. But anyway, um, so do you feel sick with breast cancer? Some general symptoms that breast cancer may have spread include feeling constantly tired, constant nausea, feeling sick, unexplained weight loss, or loss of appetite. Mm-hmm. Mm. Can you live 20 years after breast cancer? Since the hazard rate, I don't know what the hazard rate means, associated with inflammatory breast cancer shows a sharp peak within the first 2 years and a rapid deduction in risk in subsequent years, it is highly likely that the great majority of patients alive 20 years after diagnosis are cured. Okay, so I think I kind of understand that. And I think I just explained that. But, okay, so if you get breast cancer, right? And after 2 years you're still alive, then chances are that the death rate or something, the hazard rate, will go down. And then from 3 to 20 years, if you still, have it or whatever, after 20 years, you're cured. So that's it. Maybe I should start some other research on breast cancer for this month, which I probably won't do. But maybe I'll do a little something like maybe next week. What's today? Friday. So maybe next Friday I'll do some other type of research and may throw up a video. I don't really want to throw up a video. I need to get some slides. I need to do a PowerPoint. Anyway, let's pray for people with breast cancer. Let's all get our mammograms. I'm 52. Ladies that are in my age group, or I think, I don't know, when are you supposed to? I think at 50 or 40, you're supposed to get mammograms every year. But with COVID, with people who are getting evicted, people who don't have medical insurance, it's kind of hard to go and get a mammogram. You got a lot of things to do. People are surviving. Like, I think one of my neighbors moved out because it was, she abruptly, was like, oh, I'm moving at the end of the month, huh? But I think maybe, she didn't pay her rent for the past 18 months. And, with the September 30th, I think she was like, you know what? It's time for me to go. Maybe. I don't know. She just had a baby, so I don't know. Anyway, deuces. Get those mammograms, ladies. Bye.